Welcome back to the Invest in Your Health, sponsored by the Prevent Cancer Foundation on WTOP.com. My guests today are Bo Aldige, CEO of Prevent Cancer Foundation, and Dr. Jim Mulshine, who is a professor at Rush University and vice chair of the board of Prevent Cancer Foundation. Thanks for being here.
Our pleasure.
My pleasure.
Wonderful. Well, in our previous segment, we talked about cancer as a preventable disease, and now we are going to dive into the links between viruses and cancer. So first of all, tell me, what are some common cancers caused by viruses, and are these cancers preventable?
The fact is that many cancers are caused by viruses. I think the one that's best known probably is cervical cancer. It's been known for quite some time that the HPV virus, the human papillomavirus, causes cervical cancer. But it wasn't known until relatively recently that it causes at least 5 other kinds of cancer, one of which is oropharyngeal cancer, which is a cancer in the back of the throat or in the tonsils. And that cancer is on the rise. It's one of it, and it is a lethal cancer, because it's very hard to detect. You can't really see that part of the throat, so it's hard to find it, and sometimes it's referred to as head and neck cancer.
Okay.
But it occurs in men. It's important to know that these cancers related to HPV occur in both women and men. But the most important thing is that there is a vaccination against this virus that's been available since 2006. It has evolved, it's improved, it works against more strains of the virus, and it should be given to girls and boys at the age of 11 or 12 to convey a great deal of immunity against HPV. HPV occurs sort of naturally. About 80% of people will have HPV during their lifetime, but the majority of them just clear the virus naturally. But for those who don't, the vaccination is absolutely critical. The other cancer that's caused by viruses, or it has a link to viruses, is liver cancer. And liver cancer is a really lethal cancer. It's on the rise in this country, and it is related to cirrhosis that was caused by either hepatitis B or hepatitis C. Hepatitis B, there's a vaccination against it. It's given to infants now. And then there's a repeat one, I think, in about 6 months. And hepatitis C, we don't have a vaccination, but we do know how to screen for hepatitis C. And there are many new therapies for hepatitis C, which actually can lie dormant in the body for years, but then cause very serious cirrhosis, which is scarring of the liver. And that can lead to liver cancer. So these are viruses related to cancer that we can do something about. And that's why we developed this program called Think About the Link, which is an educational campaign to try to get healthcare providers as well as parents to understand the need for getting their children vaccinated, and also to raise awareness that hepatitis B and hepatitis C can lead to liver cancer.
Okay, great.
And this is an important aspect of what Prevent Cancer Foundation does. I've had the privilege of working with the foundation for the last 25 years. I'm a medical oncologist by training. And certain of these things, can become advanced cancer and, wind up being in the purview of medical oncologists. Mm-hmm. But the remarkable thing has been the growth in our understanding of the linkage between these specific viruses and transforming into these cancers. Now, these cancers, as Bo said, can be quite aggressive. And if you can, vaccinate a child before there's exposure to these things and skip all that, it's remarkable. It's miraculous at some level. A century ago, the leading cause of cancer death in women in the United States was cervical cancer. And now, we're talking about programs to basically eliminate cervical cancer as a cause of death. I don't know if we'll get there right away, but we have the tools. And so Prevent Cancer has played a remarkable role in developing the professionals that do cancer prevention in cancer centers and in state health agencies across the country. And they've been doing this through a process of grants and fellowships that they award on an annual basis. It's part of over $200 million that Prevent Cancer has invested in programs, grants, and fellowships. And in fact, over that period of time, they've really spawned the next generation of leaders in cancer prevention across the academic institutions of this nation. And so you wind up seeing Prevent Cancer being very impactful because it has a very large network. And that network is involved in very, very breaking areas across the spectrum of cancer. So they bring back notions and this think about the link. Prevent Cancer has been on the forefront of advancing this dialogue. It's a tough dialogue because a lot of mothers don't want to be talking to their daughters. A lot of fathers don't want to be talking to their daughters about cervical cancer. But we have options here that if we have a higher compliance rate with these vaccinations, we can eliminate these dreadful diseases and just make them part of the history books. So it's a very, very important function that we're talking about today.
Great. And Bo, I know you mentioned too that oftentimes the hepatitis B vaccination is given to infants. Mm-hmm. As far as HPV goes, is that something that parents of preteens need to ask their child's practitioner for? Is it something that is given? How do you kind of initiate that conversation?
We feel that the provider should initiate the conversation, but the parents should be aware of it so that if the provider doesn't initiate the conversation, the parent should ask for it. Mm-hmm. They should say, my child is going into 6th grade and he or she is getting Tdap and the meningococcal vaccine. What about the HPV? I've heard about it. Why aren't you recommending it? Because this is a big problem, is the messaging on the part of healthcare providers. And that seems to be a big stumbling block into the relatively low uptake of the vaccine in this country. Australia has a better than 90% vaccination rate for girls and boys, mm-hmm. and ours is in the 40s.
Okay.
Yeah. And the conversation started in the context of cervical cancer prevention. Mm-hmm. And then there was a growing understanding of the impact of this in terms of preventing the oral pharyngeal cancer that Bo just described. And so now it's a conversation that has to be had with both boys and girls mm-hmm. At a time before they would have exposure to any of these viruses. So it is challenging, but it is something that if people are aware of and can follow through on, it is not terribly expensive and it has not been compromised by many side effects, so that the upside is very pronounced in regard to this intervention.
It's very important for parents to understand that the CDC does constant surveillance of vaccines that have been approved and are marketed. And this is one of the absolute safest vaccines that's ever been developed. So if you hear about side effects, chances are they were not related to the vaccination. They were probably just spontaneous. But it is it's a really extraordinarily safe vaccine, and it is continually under study.
The hepatitis issue is become more pronounced as we have more immigration from Asia, because it turns out it's a very dominant public health problem in areas of Asia. And in fact, our experience with vaccination towards hepatitis to prevent hepatocellular carcinoma arose out of the experience in Taiwan, where they did this brilliant experiment where they vaccinated large portions of their populations and followed them for a number of years to demonstrate the effectiveness. And as we have more Asian populations in the United States, there's a certain amount of people that have exposure previously, mm-hmm. but hepatitis has become a much more common disease, and it's a sexually transmitted disease that has very broad exposure in populations. And so, again, trying to get ahead of that with the vaccination program makes all the sense of the world. These are very, very dangerous diseases, and to avoid them is just tremendously more beneficial than to have
common
to
sense
deal with the consequences of them. Yes.
Well, and now, are you ever too old to receive the vaccine?
HPV has it was initially approved for 11 to 26 in girls, 11 to 21 in boys. It has now been extended from 26 to 45. So there can be what they call a catch-up vaccine. So if you're of the age that it wasn't available when you were 11 and 12, it still conveys immunity. It doesn't convey the level of immunity necessarily that the childhood vaccination did, the adolescent vaccination did, but it still doesn't hurt and probably helps.
Oh, that's interesting. So is there any other group at risk for hepatitis B?
When people travel to Asia and other parts of the world where there's a very high incidence of hepatitis, there's a recommendation that they be vaccinated for hepatitis B in those settings. And hepatitis B is becoming a much more commonly disseminated disease. So there's a need to think about hepatitis B vaccination, and that's one of the things you might want to talk to your doctor about, is whether or not you would be in a risk group that would benefit from that approach.
I'm your moderator, Rachel Nania, on Invest in Your Health, sponsored by the Prevent Cancer Foundation on WTOP.com.